Here's the important part. Tertiary endpoints typically capture outcomes that occur less frequently and may be useful to explore more novel hypotheses. Tertiary endpoints can be interesting, thought-provoking, and hypothesis-generating, but cannot be utilized to establish causation. The Traverse trial did not find that testosterone increased the risk of atrial fibrillation, acute kidney injury, or pulmonary embolism. It was an observation only. So it's always a good idea to understand the prior literature on a topic in order to understand where the conclusions of a new study make sense. So with regard to atrial fib, Rob, acute kidney injury, or pulmonary embolism, what does the previous injury show us with testosterone therapy? What does it show us? Well, it shows us decreased incidence of AFib with testosterone therapy.
Yeah,
it shows
appropriately prescribed, right?
Decreased in the QT interval, therefore reducing arrhythmias with testosterone therapy.
Yeah, it wouldn't be the fact that they were morbidly obese. That wouldn't be the cause of their AFib. That wouldn't be why they're having PE.
Well, Rob,
couldn't be that.
You've mentioned this study, Rob. Here's a meta-analysis on testosterone does not increase the risk of venous thromboembolism.
No.
And here's long-term testosterone therapy improves renal function. Here's testosterone therapy lessens chronic kidney disease. So when the weight of previous literature favors the opposite result, it raises the possibility that there was something about this particular study that confounded the results. What do you guys think that could be?
Oh, we know.
All right. Think about it. The study was done during the pandemic.
Yep.
And many of these studies developed COVID during the course of treatment. What do we know about COVID and the incidence of AFib, pulmonary embolism, and acute kidney injury? Well, COVID results in new onset AFib in a high percentage of patients.
Yep.
They even name it COVID hard. Increases arrhythmia and AFib.
Unreal.
COVID increases venous and arterial thrombotic events. We all know that. It's pro-inflammatory. High incidence, 14% of patients in this study developed a pulmonary embolism with COVID. And here we go. 46% of people in this study, after they got COVID, had an acute kidney injury. We've never seen testosterone in any randomized control trial ever cause an increased risk of AFib, acute.
Because it doesn't.
And let me add.
So once again, that study, it was an observation. It was just a statement,
right?
Not causation. And I wanted to make sure we nipped that in the bud in this podcast, and it's been nipped in the bud. All right.